Hi everyone, this is a video regarding our new PACU/Phase 2 physical therapy workflow. This will help us better understand how we are going to know if our patients are ready for physical therapy. In this video, Shamia, a senior physical therapist here at Kaiser Fontana, will demonstrate the assessment tools that we will be utilizing during our assessment. Prior to assessing our patients, we want to make sure that their pain level is tolerable and that their distal sensation is present.
So we're going to take a look at a couple of different motor function tests just to make sure that your patient is ready to be mobilized by PT. So the first thing you want to look at, we're going to work up the chain, is if the patient has full ankle dorsiflexion and plantar flexion. So what I mean by that is, can your patient move their ankle all the way up and point their toes all the way down? So you're looking for full ankle dorsiflexion and plantar flexion. The next thing you want to look at is whether your patients, whether they're total knee patients or total hip patients, do they have the appropriate quadricep contraction? So how we assess that is by looking at their quad set, if they have quadricep initiation. The best way to do this is if I put my hand underneath, cue the patient, can you please push your knee down into my hand? And you should see this muscle group contracting. So go ahead and let go again, April. This is April, relax. Go ahead and push down again, and you'll see the kneecap kind of come down, and you'll see the muscles initiating a contraction. So with that, you want to see if they can hold it for 3, 2, 1, and relax. Go ahead and do it again. 3, 2, 1, and relax. So you know that they're getting good, solid quadricep contraction. To kind of build on this foundation, once they have the quadricep contraction in place, is you want to initiate the quadricep contraction, hold for 3, 2, 1, and also ask the patient to lift their leg up. A lot of times when they don't have good quadricep contraction, what's going to happen is they're going to start lagging and their foot's going to start dropping. So you know that they're going to start buckling when they get up, because they're not getting good initiation of the quadricep control. So again, you want to do the quadricep contraction, but then also ask them to lift their leg straight up. We're not looking for a huge movement of the straight leg raise, as long as they're able to hold the contraction and lift their leg up a little bit. This indicates that they will not buckle once we come in the room and get them to stand up. So we looked at ankle dorsiflexion, plantar flexion, quadricep initiation, and quadricep initiation with straight leg raise. The last one that you want to look at is gluteal initiation. That is very hard to see. It's a lot much more easier to palpate the muscle group, which you don't necessarily have to. I know it could be an issue with palpating the patient in that position, in that region. So what you want to do is, if you can go ahead and lay all the way down, April. Just ask them to squeeze their butt cheeks together. And I don't know if you guys saw in the video, her pelvis tends to kind of scrunch up and lift up a little bit. Relax again, and she goes down. Go ahead and squeeze your butt cheeks together and hold for 3, 2, 1, relax. You can kind of see it more from here if you don't feel comfortable palpating the muscle group, which is obviously posterior lateral or just posterior. And I would also, it doesn't really matter if the patient has only had hip surgery on one side or the other. I would still tell them to squeeze both their butt cheeks together so that you're getting overflow. Usually a lot of times if you ask the patient to just do it on the surgical site, they might not know what you're talking about, because it's really hard to isolate just one glute versus the other. So you always want to ask the patient, squeeze your butt cheeks together, hold it for 3, 2, 1, relax. And now you know that your patient is ready to be mobilized by physical therapy. So the reason why we want both gluteal muscles to be squeezed at the same time is if I'm just isolating one muscle group, one glute set, and just contracting one, which I'm doing right now, I don't know if you guys can see very well, you really aren't able to see, although I'm contracting one glute muscle. But without palpating, without touching, if I contract both my glutes, you can see it from the rise and tilt of my pelvis, that I'm actually contracting both glute muscle sets. So it's easier to get both of them done, ask the patient to contract both rather than just one, which I don't even think you guys can probably see on the video. The last part of this is we do also want to make sure that their orthostatic blood pressure is all right, so that when we come in the room, sit them up at the edge of the bed, dangle, or even stand up, that they're not going to pass out due to blood pressure issues.